I still see the...
You're right.
Okay.
You're right.
Good evening, everyone, and welcome to the Brock Youth Center's inaugural virtual hackathon on youth mental health and wellness. We are really excited about the process and the solutions that are going to happen this weekend. But you have to know that no matter what else happens over the weekend, that this event has already been a success. The Brock Youth Center is located at the very northern end of the region of Durham in a rural community where transportation is often an issue. And that's one of the reasons why we decided to run a virtual hackathon rather than one in person. And given the weather, that probably was a good decision today. So we're really excited to see how this event unfolds. I want to tell you a little bit about the Brock Youth Center. And so our tech guy is just getting me set up here. Okay. And why the Brock Youth Center is doing an event like this. And as I mentioned, it's because we are a rural organization and virtual seems the way to go. But who we are as an organization. Our mission is to provide innovative programs and services to improve the social and economic well-being of youth in North Durham. And we do try to be innovative, and living in a rural community, we have lots of opportunity to do that. And our focus is on entrepreneurship development and employability skills training for youth in North Durham, youth ages 15 to 29. And we've developed a program called EDGE, Entrepreneurship Development for Creating Employment. And the reason that we have done that is because it's challenging for young people to find jobs that do challenge their capabilities often. And so we do our entrepreneurship development program, and we help young people develop a business plan and a marketing plan, financial plan, and they put it together and pitch their business to a Dragon Den style panel of judges, which is very similar to what you will be doing on Sunday. And these are two of our young entrepreneurs who have won the pitch competitions, and they have very successful businesses going in North Durham currently. We also establish social enterprises to give youth the opportunity to work in a business, a small business, in an entrepreneurial environment without having the financial risk of being the business owner. And the first one that we have set up is a Cool Cow ice cream parlor in Beaverton, and it's been very successful. The hot summer really helped with that success this year. We sold a lot of ice cream, but we've had over 60 youth learn about profit and loss and inventory management, all of the pieces of running a business. They do much more than just scoop ice cream, and we are actually training them in entrepreneurship. And so what does all of this have to do with the hackathon that we are doing this weekend? Our goal of this virtual hackathon is to have you create a mobile application that targets youth mental health and wellness. And this app will be used as the foundation for a new social enterprise. Our goal is to develop a youth-run social enterprise that further develops the app and then develops the marketing and sales plans so that this app can be marketed throughout Ontario and beyond. A goal that will take some time to establish, but that is what our plan is for this app. And there was the region of Durham and Lake Ridge Health have done some roundtable discussions throughout Durham. And one of them was held up in the north end of Durham. And they gathered a group of adults and teenagers together, asking them about life in the rural community and the mental health perspective. And the result that came out of that from the young people was that they would appreciate an app that would allow them to access some information, because it is so much more difficult for them being in a rural community to be able to access that. So between the desires and the comments and needs of young people in the area and our goal to establish a social enterprise to give youth the opportunity for meaningful employment, this hackathon is coming together. So the way that this weekend is going to unfold in a few minutes, Braden, who is our tech geek, I hope he doesn't mind me calling him that, he is going to go over Discord, the platform that we are using, and the things that you need to do and how you can communicate with us. And so he's going to go through that with you. And then once Braden is done, we will have a presentation by Natasha Halliday, and she is a child and adolescent counselor, and she works with Lake Ridge Health. And then there's the opportunity for you to ask questions, whether they're questions for Natasha on youth mental health or Braden on the technology and the process and the way it's going to unfold. And then when all of that is done, you can start hacking. And we will be around to answer any questions tonight until 11. Should you have any questions for Braden, if you have questions related to mental health, we can find someone hopefully who can answer those as well. So, Braden, are you ready?
Yeah. All right. So I'm going to quickly go over how you guys are going to be able to use Discord to try and communicate with both the judges, the coordinators, and your team. So in the Discord server, each of you will have a specific team chat for your team. In order to sign up for your team, you're going to go over to bots, and you're going to type ! join team @ and then the team name. So, for example, if you were part of Team 3, you would type this. Then what will happen is you'll be able to see all of the parts underneath Team 3, and you'll be able to communicate with the rest of your team. In order to ask a judge about a question or an administrator about a question, you can talk in general and at an admin, and then ask your question, and then we'll get that notification that way. You can also directly message anyone by right-clicking on their name, clicking message, and then that'll bring you to a private chat with them. Come time for your presentations to the judges, the way that we will be doing that is through a private call in Discord. So what you would do is right-click the Advocator user here, and you're going to go to call. And from there, you would be able to turn on screen sharing to screen share the application itself. And we will need to have you as a friend with all of your teammates so that you can add them to the call as well.
And you'll go through that again, right, Braden?
Yep. Come time for the presentations, I'll make an announcement about it and make sure that you guys know what you need to do. You can find all the announcements underneath the announcement link here. As for the technical side of the project, the things that you're going to need to do include functional prototyping as well as a wireframe due to the limited amount of time you have. So if your team doesn't have a coder, more emphasis will be put on your wireframe than your functionality because you obviously won't have any code. But for anyone who does have a coder, you're expected to have both.
Can they ask you any questions?
Yep, if you guys have any questions, you can either send them to me through Discord or in the YouTube chat right now. You can ask them if you want to right away. Also, any questions for Lois, you could ask now as well.
How can you tell if they're asking questions?
No one's typing anything.
No one is yet.
All right, so if everyone's good.
I'm going to introduce Natasha.
Awesome. I'll let you sit back down here.
Yeah. Okay, so that was a very quick tech review, and so I hope all of you got it. And if not, Braden is going to be here until 11 o'clock tonight, and so if you have... Oh, there is a question. Okay.
For team numbers, there are team names in there for the teams who did submit names. So you would do at whatever your team name was.
So you will notice under the team names, so 2 of them selected their own names and the others are just a team and then a number. If you want to create your own team, that's a great idea. And do we have to make that change for them or can they change their name on
the team
Discord?
Names that were already submitted are already in the Discord.
Okay,
so they'll be able to do at and then whatever the team name they submitted was.
Okay. But so they have to keep the team name they have now.
Yeah, we can change it later for them.
Okay, so if you come up with a great creative team name that you want to change, you let us know and we will change it on the Discord page.
Anyone who has any difficulty signing up for a team can message me as well, Braden Lodwick in the server.
Right. Okay, so if there are any without a team, then we will get you squared away into one. And so after Natasha gives her presentation, then we can take care of all of those details. Does anybody else have another question before I introduce Natasha? Okay. So Natasha Halliday, as I mentioned, is a child and youth counselor at Lake Ridge, and she has been working with youth for the past 20 years, and youth and living and having them live well and living a good life are her passion. And so Natasha is going to sort of give us that mental health background that will help you in developing your app.
Oh.
Okay.
I'll talk to you later, Hawaiian Tony. Yeah, sorry if I pronounced that wrong, but I'll PM you in the Discord server and we'll get you set up with that.
Okay, so Natasha.
Yep. All right, Natasha, you should be on.
Can we hear her? Oh. Is her audio off? Oh. Can I hear her?
I should be able to hear.
She turned her audio off, I think.
I should be able to hear.
Okay. Do you want me to phone? Would it be at her end?
Yeah, text her.
I think I can call her.
It might be my fault here, one sec. They might be able to hear now. Yeah, they can hear now.
Oh, can they?
Can you guys hear me?
Okay. Can you hear her now, Pat?
Can you guys hear me? Oh, there we go. I heard my voice. Yeah. Oh, there we go. I heard my voice. Yeah. Okay. Sorry about that confusion. I had the mic muted while I was waiting for things to get started. Thank you, Lois, for your introduction. And hello, all. This is a little different because I can't see any of you. But as Lois said, I've been a child and youth counselor for 20 years, and I love working with youth. I have spent the last 17 years working in different hospitals in child and adolescent mental health. And so it's definitely my area of expertise and my passion, and what I just love to focus on, doing anything I can to be of help to youth with anything that comes up and presents. So I'm really excited about this because I think it's a really amazing idea to be able to look at how to come up with an app that can, one, bridge the barrier of distance. It can do just so many things, and I'm going to get into that a little bit. Just wanted to talk to you a little bit about some of what I've seen first in terms of just dealing with youth with mental health issues. Like I said, I've been doing this for quite some time, and young people have presented to hospitals and other areas I've worked with a variety of things, such as sadness, depression, anxiety. So they're just experiencing lots of worry. It could be anxiety specifically to social matters, or just what's called generalized anxiety, where they can't even pinpoint what's making them feel nervous and what makes them feel anxious. I've worked with young people who experience things like psychosis, where some of their reality is off, things like substance issues, and just general stress from family issues, school, being bullied, you name it. So any one of these things can contribute to a young person having some difficulty with their mental health and their mental wellness. I kind of look at things from the perspective of, we all have stress, and it's nobody's right to judge how it manifests. So if I have stress and I get an ulcer and somebody else has the same stress, but they get anxious, there's no one has the right to judge that and decide that one way of experiencing stress is wrong or better than another. So that's kind of the perspective that I take so that I can approach young people with an open mind. As I was saying, like some of the things that I've seen young people present with are things like depression, where they experience a low mood. This thing can impact motivation, can definitely impact people's ability to sleep well. Some people find that they're sleeping too much. Some people find that they're not sleeping very well at all. They find it hard to fall asleep. Even after they do fall asleep, they're waking up frequently. They're not getting what they feel is a restful sleep. So when they wake up in the morning, it doesn't feel like they've slept at all. Things like depression can impact things like your appetite. So again, you can have both ends of the spectrum. Some people find that they're eating a lot, and some people find that it just kiboshes their appetite and they're not able to eat at all. So that's definitely another thing that can be a part of showing that somebody's experiencing depression. One way that depression is described is as anger turned inward. So often some people find that they feel agitated and they're irritable. And so it's harder for people to understand that that actually is a symptom of depression. They just think that this person is, an edgy person or an angry person, and missing that might be connected to something else. And if I can give you guys a visual image, if you picture an iceberg, if you ever seen a picture of an iceberg, and I wish I'd had one to put up here, an iceberg shows a little bit at the top, and underneath the surface of the water, there's a whole lot more going on. The size of that block of ice is much larger. And when you think about things like depression and anxiety and just dealing with people in general, what I always want people to know is that we cannot just focus on what's happening on the surface. We have to be aware of what's happening below the surface to really be of help. Another thing that, like I said, that young people encounter is things like anxiety. So as I've said already, maybe experiencing just that general worry where you're not really sure what's making you feel anxious. You just know that you feel nervous in lots of situations. Sometimes it's specific to things like social interactions. And when it's related to that, people might assume that the person's shy, but it could be about second guessing yourself and worrying, what do people think of what I say? What do they think about what I'm doing? There's often the perception that you're being judged, perhaps more than you actually are, but it's hard to tell. And when we're worried about those kind of things, it makes it much harder to have those kind of interactions. So that's also something that comes up when I deal with young people. Those are probably the most common. Or sometimes you're just, because I work in a hospital and I work with doctors, people are often looking for diagnosis. But diagnosis isn't always that important, because knowing what's going on gives you an idea of what needs to be addressed, or knowing what the person's having difficulty with gives you an idea of where they need support. So I want you to keep that in mind when you're thinking about creating an app. And what I love about this idea is I see young people as the expert in young people. I was young before. I'm not as young as I used to be. So I know things about being young, but I didn't grow up with as much technology. And so I don't know what it is to, as much as I've worked with youth, there's things that I know about youth, but my perception and my perspective can't be the same as someone who's living the life of a youth right now. And so I think it's really great that you guys have that opportunity to speak from a framework of, I am this young person and I've seen people experience different kind of mental health issues, and I've perhaps experienced different kind of mental health issues. Statistics show that just over 1 million children and adolescents experience or are affected by mental health. And so that means that chances are when you're in a room with a group of people, several of those people have had some kind of encounter with mental health, whether it's depression, anxiety, psychosis, any number of other things that could present. there's that possibility that they've had that issue. And what's interesting is the studies show that for as many people who struggle with mental health, it's a lot less that actually get support with that. And what's great about this idea of creating an app, you guys are at the forefront of looking at what's one of the ways to support people when they're having trouble accessing that help. And I think a big part of it starts with people don't even know where to start to go to access help. And my understanding is, living in communities that are a bit more remote, like North Durham, it's even harder to access that. So I love that using technology is trying to bridge that gap between maybe not being able to get to a center that offers services. Or I know from working in mental health in hospitals, as great as the programs that I work in are, there's often quite a lengthy wait list. And so, it's really upsetting because I work from the inside of the system, but I still know how many things are not necessarily working with the system. And it's really hard to hear somebody say they're experiencing this level of distress and we can't always meet that need immediately. So again, what I think is really great about an app is here's something in your hands, at your fingertips, accessible to you at all times that gives you some ideas of how to manage different stressors or to manage your mood when you're struggling with your mood or any number of things that may be related to mental health. So I really, like I said, I really like this idea. And I think that with the right information, right there on your device, it will be, or on anybody's device, it'll just be such a great way to give people options and to move them out of the frustration of not knowing where to go or not having access to something, not being able to get a service in a reasonable amount of time, as sometimes happens, unfortunately, in the system. And I really like the idea that it's kind of on the spot, and something like an app becomes a 24-hour option, and a lot of services aren't 24 hours. So I really like the idea that there's something that if I have nowhere else I think that I can go, I can just pick up my phone and go to my app, and I have an option for getting some level of support. And that could be the difference between somebody feeling like they don't know how to get through that day and then being able to get through that day and come over that hurdle of whatever they're experiencing that's upsetting to them in that moment, or perhaps has been upsetting to them for a long time and they're really struggling to deal with it. So just some of the things that I thought that maybe I could explain to you about what I think would be really helpful to go in the app is maybe looking at some coping strategies and some coping mechanisms. So if I'm feeling sad, what is something that I can do that might help improve my mood? If I'm feeling like I don't like my life, if I don't like myself, if I don't want to be alive, because these are any number one of the things that can surface when somebody is experiencing a mental health issue, what are some things that I might be able to do so that I know I have an idea of how to manage this thing that I'm experiencing in this moment? And, like many things in life, things come in waves. So those feelings might be really intense at some points and not as intense or not existent in other points. But in those moments that it's really intense, what do I do? Because I know for me personally, the more stressed I am, the harder it is for me to think clearly and know what to do. So if I have something that I can access that gives me those tips, it's not necessarily about what I think in the moment. I have something on hand that says, here are some things that you can do. And then I can give those things a try and see how helpful they are to me. So keep in mind that the app is to be easily accessible. And I think what's great about it coming from young people is you can use what, people call user-friendly language. So sometimes adults, especially when they've done, they've been to school for a while and they do lots of studies, or they work in, like I work in hospitals. So some people come with all this medical jargon and this language that doesn't really make sense to people. And I think what's great about having your input and having you guys create it is you're using language that that you guys would understand. And I think that would make it, like I said, more user-friendly. So again, you want to provide strategies and tips and tools for how to cope in positive and helpful ways, because sometimes people have ideas about how to cope and they do things in a moment that might make them feel better just in that moment, but it's not really helpful over time. And so when you're thinking about what strategies for helping, what strategies for coping, it's got to be things that are going to be helpful in the moment, but also helpful over time. So for example, and I'm not judging anybody who does this, but if somebody says that they cope by smoking, we know that smoking is not healthy for the body. So it might be something that in the moment helps, but over time that may not be the most helpful thing. And like I said, I'm not making a judgment about it, but just using that as an example of how something might feel helpful in the moment, but over the long run may not be as helpful. So keep in mind when you're looking at what are the tips and strategies, what is going to be helpful in the moment, what might be helpful over time, or at least we know is not going to cause more potential problems or other problems in the long run. I think that it would be really great for the app to provide things like some contact information and some support resources that might exist in an area if that's possible, right? So if there is a community center that offers services, if there is a hospital, if there is an agency that provides services, it always helps to maybe have that stuff on hand. A crisis number, who can I call if I just need to get some stuff off my chest and talk to somebody? Because often people find that being able to talk about what's going on is helpful. And so having that as an option would be really great. My bet is that coming from you guys, it's definitely going to be something that then makes it more relatable for the people, for the young people that are going to use it. Like I said, going to that user-friendly language. I just to go back a little bit in terms of what I've done in the time that I've worked with youth. I see youth struggling with, like I said, anger, sadness, anxiety, fear, stress. There's so many things that people can be present with. And one thing I've learned over time working with young people is it is good to talk to family, but there might be that moment where if I tell you all this stuff and then I have to sit at the dinner table with you day after day after day, I might just feel that that's all you're focusing on. And so the great thing about this app too is it can provide another outlet, another way to be able to get some of that support. You can look at how, if there's a way to get things off their chest, is there a journaling like a journaling portion that you can do in the app that allows for that kind of venting that sometimes people find really helpful. And thinking about all those different things, what are specific strategies related to if you're feeling sad, related to if you're feeling anger, related to if you're feeling fearful, if it's general stress or specific stress, like how to manage school stress, how to manage stress with peers. And this day and age, I would add how to manage stress with social media, because it can be a stressful thing. So looking at all those different kinds of things, I know that in the work that I do, one of the things we find challenging is somebody might come to the hospital, they might be admitted to hospital, or they might get services in our outpatient clinic. But a challenge we face is how to keep the practice of the good coping skills and the strategies that we're teaching them outside of that setting. And so what I think is really great too about having this app is the app gives that ability to continue practice. So if you've taught somebody certain strategies, there's a way maybe that the app can reinforce that. And I think that provides that 24-hour support that would be really helpful. Give me 1 second. The other thing too is I think that it can also be collaborative and work hand in hand with the treatment that somebody's already receiving. Already in the work that we do, my colleagues and I encourage young people to use different kinds of apps. But my guess is that Most of them have been created by adults and haven't had much input from young people. And like I said before, I think that, you guys are experts in a way that adults can't be, because we aren't youth anymore, and we don't understand specifically what you're going through exactly as you do. I think we can be empathetic and we can provide understanding to a certain level, but we're not living it out day to day in the way that you are. So I would say take what you experience day to day to consider what you think needs to go into it. How does, like I said, social media impact mental health? How does the pressure for school, if you're in high school and you're thinking about post-secondary school, how does that pressure impact how you feel? How does the pressure of, just peer pressure and fitting in and all these different aspects impact how someone feels? Because all these added stressors can be reasons that people experience different mental health issues. And that's separate from things like even just genetics. Somebody might have in their family line a history of things like depression, anxiety, and already be at risk for it just because it's in their bloodline. But on top of that, when we add all the stressors that life presents, it becomes even more challenging. So I think that, you guys can really take advantage of what you know from living everyday life as a teenager to be able to put that into and speak to what should be in the app. Give me 1 second, sorry. What I think is really great too to consider is that, unfortunately, we live in a world where there's stigma about mental health. And so stigma does a few things, and if for people who aren't sure what stigma is, it's kind of the way people make judgments and assumptions about people based on having mental health issues. And so people often are reluctant to and hesitant to talk to people to say, I'm experiencing sadness, or I'm experiencing anger, or I'm experiencing any number of mental health issues, because they don't know how people are going to respond, and they fear how that person might respond. And, a judgment from somebody when you're already feeling bad could potentially make you feel worse. So sometimes people avoid that to try to prevent having that negative response. And I think what's really great about creating that app is having that opportunity to create privacy and to make it anonymous, and no one knows. You can have a symbol on your phone, no one needs to know what it is, and you can access it without somebody knowing. You don't have to walk into a building that alerts people that you're accessing a certain service. And I don't think there's any shame in that. But I think this also gives an opportunity to give accessibility to a service or to some ways to deal with mental health issues that can remove some of the stigma that people experience. So one of the things I want to encourage you to do is focus on mental wellness. One of the things sometimes that the services in the community do, they're what we call being reactive. So they're getting involved after something has happened. But in this app, you have an opportunity to look at ways to prevent getting to the point where you might need to go to see a doctor or go to see a counselor regularly, right? So you can focus on, how do I have mental wellness and how do I maintain my mental wellness? What are the choices that I can make? What are the things that I can do so that I stay in a position where my mental wellness is on a good and even keel, right? And so one of the aspects of it can be focusing on preventing things from getting worse because of things like maybe just recognizing what some of the triggers are for mental health issues. I think that a challenge that people face is, you can experience a stressor and go through your day and not know that that's something that might continue to bother you over time and potentially lead to a mental health issue. And it's, sometimes as human beings, we feel obligated when people say, how are you, to say fine, even though we're not fine. And so if we're not even admitting how we're feeling, then we're not really dealing with what's going on. And so maybe including as part of the app is, what are ways to recognize that things aren't as good as they could be, that things that I am having some difficulty? How do you help people admit that I'm struggling so that they can look at how to deal with that and deal with it at a point where it's potentially more manageable because it's not as bad as it could potentially get. And so paying attention to what ways can I prevent? And like I said earlier, because stats show that, if you're in a room with a good few people, chances are somebody has experienced some mental health. You've probably encountered a friend, a family member, or even yourself having some mental health issues. And so kind of where you were before it started, where you were kind of in the middle, and where you were maybe at its worst point. And taking in those things into consideration can also help you look at what are some ways that we can help people prevent getting to that point, right? What are the steps that they can take that can help them maintain a good mood, that can reduce worry and anxiety, that can promote that, not losing things in terms of reality, like things like psychosis. What are the things that will help me stay where I want to be versus going to where I don't want to be and struggling with these issues? And one of the aspects of this that we look at when we deal with mental health is one's ability to be resilient. So if you think about, or to understand resilience, if you think about an elastic band, when you stretch an elastic band and you release it, it gets stretched out of proportion, but it snaps back into its original place. And the snapping back and getting back to where you were and the desired state is kind of the idea of resilience. So some people talk about bouncing back from things. There's many ways to look at it, but that's part of that having resilience. So if something unfortunate happens, if I experience something that's upsetting, if I experience something that's potentially traumatic, what is going to help me get back to my original state or get back to a place where I'm in my state of mental wellness? And so what are the things that can be included in the app that will help people promote and continue to practice things that will make them resilient and keep their resilience? And looking at how do we stay aware of what's affecting my resilience? Sometimes it could be things like not saying no to enough stuff. And so if you take on too many tasks, they wear you down, and then you're not feeling as resilient. And then you're struggling with, your stress level based on how many things you take on. Or if you are, encountering a lot of negative impact from people or input from people, that can impact your resilience. So what could be put into the app that could help somebody keep strategies and keep practicing things that will keep them in that resilient place, or help them get back to the resilient place that they want to be if they find themselves coming out of that place? And so looking at where you kind of would like to be, what's showing you that I'm starting to come out of that place, right? So for people who experience stress, a change in appetite, a change in sleep, there's many different things that could be signs that you're not yourself. And you know yourself the best. And, think about when you're not yourself, when you're not doing as well as you could be. What is something that, shows you that? And how can you incorporate that knowledge into the app to help other people recognize when they're not themselves, and recognizing that this is the time to intervene now so it doesn't get worse? Thinking about what can you do to help yourself? What are things that promote happiness in your own life? Like sometimes people think that promoting wellness is about doing these big things that are grandiose and require a lot of effort. But I'm like, if simple things make you happy, what's a way to engage in those things? If it's listening to music, if it's watching a television program that you like, playing a game that you like, any number of these things that might take you out of a certain state and help you feel better. Sometimes it might be as simple as distracting yourself, because we cannot change everything in life, unfortunately. So if something is happening in your life that's really upsetting and you're having difficulty dealing with it, you might not be able to say, okay, I'm going to make this situation go away, or I'm going to make this situation change. But what can I do so that maybe I'm not thinking about it as much? Is there a way to accept that something's happening even if I don't like it? Because accepting it does not then make the situation okay. So if somebody's engaging in something that's upsetting to you, you're accepting that something isn't the way you like it doesn't ever say that what they're doing becomes okay. It just might be your way of not taking on as much stress from it by the way you look at it. Perspective is a big part of how we deal with mental health, how we understand things, how we looking at how we think is a big part of it. So what in my thinking is promoting me feeling good? What in my thinking is promoting me feeling bad? And is there a way to add that to the app? How do my thoughts and the way I see things contribute to how I'm feeling right now? Is this the only way to see it? So maybe a way to challenge how you perceive something might be something that you add to the app so that you can think about, somebody can look at, is there another way to look at this, right? So I often use the analogy of putting your thoughts on trial. And so when people are in court, one side argues, another side argues, and they're talking about the same issue, but they're presenting different perspectives, which help people see it in different ways. And so can we do the same thing in our own life? If I feel that, nobody likes me or something that might be upsetting to me, is there another way to look at it? Is there proof that what I thought first is true and that that's the only way to see it? Can I see it another way that's going to have me not feeling as bad as maybe my first perception had me feeling? So those are all things to take into consideration when you're looking at the app. So again, keep in mind that, this is about mental wellness. It's not, so a lot of it, part of it needs to be about what's working and how to, highlight what works, highlight what's going well. Sometimes people only focus on the things that aren't going well. But is there a way to highlight what's going well? Paying attention to that, encouraging people to pay attention to that. I know that when I've talked to young people who are struggling, they can sometimes list all the things that are going wrong. And then I say, so what is working in your life? And it's only at that point do they maybe start to think about, okay, there are these bad things, but there's also these good things. And usually when people start paying attention to the good as well, they don't necessarily feel as bad. And so is there a way to have that as part of your consideration? Again, let's go back to the idea of accessibility. How do you, the great thing, like I said, the great thing about the app is that anybody can use it. And so how can we make it as accessible as possible? Is there a feature of the app that doesn't require being on data? So that if I'm not on Wi-Fi at the moment and I don't have a good data plan, I still might be able to use an aspect of this app. Things like that would increase the accessibility. So keep in mind anything that you've experienced in a limitation in technology and how would you overcome that limitation so that this would be more effective and more helpful to somebody who is using it. Think about what has worked that you've seen in the past that hasn't worked, and how do you separate the two? What's the things that are working well that needs to be considered and included? Think about stress management too, in terms of not just looking at, like I said earlier, specific like diagnosis of things like depression and anxiety. And what about just managing when I feel stressed out? What about managing when I just don't know how to deal with something? How do I figure out what steps to take if I'm in a position where I don't know what decision to make and that's stressful to me? If I'm, feeling overwhelmed, How do I break things down into smaller portions so that maybe I can tackle them in smaller amounts? What are the things that are going to make whatever my stressor is more manageable? Are the things that I can give up? If I'm feeling stressed out by having too many activities, are there things that I'm able to give up so that I can manage the amount that I have left? So there's lots of things that you can take into consideration regarding how to manage stress that might be helpful to someone. And, the good thing about this is having those tips in there. Like I said, when people are overwhelmed, sometimes we forget what we already know. And there might be things that someone's just never taken into consideration. And so the great thing is having these teams and having different people give input is you get the ideas of different people so that you can include more things that maybe not one person would have been able to come up with. So thinking about, like I said, stress and what's going to help us function well day to day. What's going to help me get through my day? If I'm having a day where I get up and I don't want to get out of bed, or I don't want to go to school, or I just don't want to do something that I have to do, what's going to help me get up and get motivated to do those things that are part of that day that I'm struggling with, that I'm wanting to avoid? And how can I get that energy to be able to get to do those things? So these are all things that I would like you to consider. I'm really excited about hearing where this goes and what some of the ideas are that you come up with. I think that, like I said, you guys need to look at yourselves like the experts, because you are young people and you know what you deal with day in and day out. And you have a perspective that someone who's not living your life will have. So you need to be able to input the things that you've experienced in your everyday life. So good luck to all the teams. I think that's everything that I wanted to say, and I welcome any questions. Thank you so much.
Well, Natasha, thank you very much for that presentation. You've given a great foundation on things that would help not only from the mental health perspective, but from the actual use of the app and how to make it easier for the young people that will be accessing that app. You mentioned in your talk about identifying stress and stressors, and I just want to mention to the hackers that tomorrow morning at 11:30, we're having another presenter who is going to be talking about how to identify stressors in yourself and then how to deal with some of those. And so you may find that valuable and something that you might want to include in what you put into your app. So again, Natasha, thank you. And we really appreciate you taking the time today to share your wisdom and your passion for youth and their mental health and wellness with us. And enjoy the rest of your weekend. For the participants, can you just let us know what community are you from? Can you just, in the chat box, tell us whereabouts you are? Oh, nobody's telling us.
It's probably the video delay.
Oh, video delay, I hear. Okay. And the reason that I'm curious as to where you are from is that the intent for this app, and one of the pieces that we would like to see included, are resources in a community where a young person could reach out if they had some questions or if they wanted to do some stress management and the kinds of activities or the things that they could reach out to. But if you're going to create that and include those resources and contacts in your app, we would like you to do it for the community where you are. Partly the intent for this app is that it will be customizable, if you will, so that it would work for any youth in any community. And so we're just curious to see where you are from. But that's not coming up. So Braden is going to cover a couple of the tech things and see if you have any questions there, and then you get to work.
All right, so a couple things to go over just before we do start out. Everyone within Discord, I would like everyone to download this link here. And on the last page is a form that I would like everyone to submit. And so you can fill that out and then you can submit it to me here by going right click, and then I can't message myself because it's me, but you would see message there, and submit that to me, and I will send anyone who has any more questions about team information, any of the information they need. Just contact me if you need any help. And if you have any questions at all about how to use Discord, how you can get different tools that will help you throughout the hackathon, you can also message me about those.
And they know about the resources in that package.
Yes, so there are more resources within the participant package. You can also find more resources on the Hackathon website. And I hope everyone has a great product. Good luck to everyone.